Hello, I'm Charlotte Owenberg, editor of Race to Zero. I'm joined today by Dr. Leslie Cho, Professor of Medicine and Section Head of Preventative Cardiology and Rehabilitation at Cleveland Clinic. Thank you, Dr. Cho, for joining me today to discuss the impact of climate change on cardiovascular health.
Thank you, Charlotte, for having me. I'm excited to be here.
Dr. Cho, could you tell me a bit about the impact that climate change is already having on our cardiovascular health and the range of conditions affected?
So we've already seen an increase in cardiovascular death as well as heart attack and stroke. And the really unfortunate thing about climate change and extreme heat is that this is something that can be prevented. And yet we're seeing this rise in cardiovascular mortality and heart attack and stroke. But also the other important thing is that it's already increasing things like diabetes and high blood pressure. It's having what we call cardiometabolic effect. So let's say you have extreme temperature, it unfortunately causes an autonomic dysregulation. People with high blood pressure, the elderly, the diabetic, they're affected. There's very good growing evidence that it increases your clotting, and so you're more likely to have a heart attack. There's an increase in inflammation, which we know leads to plaque rupture, which is how heart attacks and strokes can occur. So it has a damaging effect there. And of course, extreme heat leads to things like wildfire, which then creates air pollution, which then also increases horrible things like heart attack and stroke. But it also has this sort of very insidious effect of increasing things like high blood pressure and diabetes. And there's very good data that if you are exposed to extreme temperature acutely, like so let's say you're having a couple of days of very, very hot weather, and we know this from the German study too. You have an extreme temperature, and we're talking about extreme temperature like 18 degrees Celsius. We're not talking like crazy extreme temperature, where you have this sort of increase in temperature and it leads to about 1 to 3% increase in heart attack, which is astounding. And then long term, so let's say you are exposed to it for a longer term, obviously it has a detrimental effect on people with heart failure. I mean, it's a really, I think people, when they hear things like climate change and when they hear things like this, people are often like, what's that got to do with me, right? But it really hits us in a very personal level because all of us have parents, all of us have children, all of us have loved ones, and climate change directly impacts our health. I mean, directly impacts our health. And there is nowhere you can go. There is no place that's safe. Um, no one's immune. And I think that's why it's so important for us to take things seriously. Air pollution, like from wildfire, emissions, carbon emissions, and things like that, have impact on children, childhood asthma, respiratory disease, but it also leads to, arrhythmias, clotting disorders, increased risk of getting diabetes and high blood pressure. It really has tremendous impact on personal health.
A study from the Lancet year that found that between 2000 and 2018, heat-related mortality increased by 53% in over 65s. So given that we've already experienced a 1 degree C temperature increase
Yes.
since pre-industrial times, what do you think the impact of further temperature rise is going to be on our cardiovascular health?
I mean, I think we don't have to imagine it because we've all in this world have experienced it, what it's like when a healthcare system is overwhelmed. And when you have a increase of temperature leading to increased cardiovascular mortality, heart-related death, and of course heart attack and stroke, and then you have an aging population, your health system is going to be inundated. we've seen that. All of us on this planet have seen that this year. So I don't have to tell anyone, oh, imagine what it's like. We've all lived through it this year. And it has a global impact. And also forget healthcare. Okay, so let's say you are young and you don't care because you think like, okay, I'm totally immune. Although young people are much more in tune with climate change than the middle age and the elderly, I think. But even if you say, oh, you know what, I'm healthy and that doesn't affect me, our livelihood, the way we live our lives, the global impact of this is tremendous. And I think that, you know, there's a wonderful poet in United States. He's also an agriculturalist and an activist. His name is Wendell Berry, and he has a very wise saying, and he says the earth is what we all have in common, and it's 100% true. And like we have that in common, and in 2020 we've learned what that means, to be intimately connected to one another, to have, there is nowhere you can go, no amount of wealth can make you safe from pandemics. And as we have climate change and as our temperature tends to rise, the zoonotic disease, like, you know, where you have animal transmitted disease to human, what we think happened with COVID, is going to increase. That's not going to decrease, that's going to increase. And so it's really important for all of us to take it seriously. You know, I'm a cardiologist, I'm a heart doctor. And, you know, for me, cardiovascular disease prevention has been a calling. And I often think about that for how do I reduce the risk for heart attacks for my patient? And, you know, we talk about, you know, eating healthy, which is very important and very intimately linked to climate change, and, you know, getting exercise and things like this, which is so important too. But part of prevention, you can't talk about prevention without talking about climate change these days, because they are so intimately linked.
So what would you say to someone who's saying, I'm waiting for technology to catch up, or I'm waiting for governments to implement the right policies, or non-state actors to make the right business decisions or investment choices? What should people be doing in their everyday lives to ensure that they're protecting their health from the growing impacts of climate change?
I think one of the most important thing, you know, there's an astounding statistics out there, and that is that about 35% of carbon emission comes from the food we eat. Not just like food waste, not just transportation, but the food we eat. And the amount of animal products we're eating, especially beef and dairy, because of how the land is used, but also the carbon emission from the animals, like the methane production from the animals, really has a dramatic impact. And the really great thing, I don't know if it's a great thing, but it is an important thing, is that eating less meat makes you live longer, have less heart attack, less cancer. And so if we can do something good for our health, and also it's good for the planet, oh my God, what a winning combination, right? I mean, that's an unbelievable combination. So let's say you're totally selfish. You don't care about the planet because you're like, you know what? I don't care about the planet. Okay, fine. Do you care about yourself? Do you care about your health? What about your chances of living a long life with less dementia, less cancer, less heart attack, living a high quality? Well, you should care about that then. And then we can make an impact. I mean, I think what kind of transportation we're using is super important. You know, the great thing is if you bike to work or walk to work, if you're so lucky to be able to do that, not only makes you live longer because you're exercising, but is also good for the planet. You know, eating healthy is not just good for you, but also good for the planet. I think those things are really, really important. I think, you know, we think about like, I want the government to do it. You want the policy to make change, but, you know, individuals make up that policy. Individuals make up a country. And, you know, we saw very recently the world, like what it means for devastation to occur in one part and then for all of us to be affected. It's really important that we do everything we can to prevent or to obtain the zero goal, the zero carbon emissions goal. But I mean, not just for our children, but for ourselves. It's really important.
And can you paint a picture to people of what that zero carbon world looks like in terms of our human health?
I mean, there's been great projections, and I think that, I want all of us to be hopeful, because how can we live if we all live in doom and gloom? But there is really good projection that if we do zero carbon emission, that we can prevent excess mortality and not forget just dying early, which is important because you don't want to die, but having a high quality of life, like less heart attack, less stroke, less diabetes. I mean, it's, we often think about like, we often think like, okay, zero carbon emission, like what does that really mean for someone, like on a personal level, what does that really mean? Well, what if that means that you were having less heart attack, that you were having less stroke, that you were actually living longer? Like, that's a really important thing. And I think that part of the issue about climate change that's been politicized, that's had all these sort of incredible, like, um, visceral reaction from people, from disbelief. I mean, I don't know. I find that perplexing, as a person, but also as a doctor. But I think there is no doubt in my mind. All of us know, all of us have felt what it's like during a pandemic. And if we have that in 2020, imagine what 2040 is, when we have increase in temperature, when our healthcare is inundated with cardiovascular events, and we're reliving 2020 and 2040, and we can really do something to stop it today. I mean, the amount of carbon emission reduction during 2020 alone, I mean, that means we can do it. Like, we can make serious changes where we can do it. I really believe that people everywhere are good fundamentally. And I think, given the choices, and I think society obviously has to make that choice, but society starts with individuals. We're responsible, all of us, for our own health. And I think that, if nothing appeals to you, if climate change doesn't appeal to you, if nothing appeals to you, I think appealing, like, just for your own selfish benefit, just for your own health's sake, it's important to eat less meat, to exercise more, to reduce your exposure to air pollution. And just that alone should galvanize the society and our public into adopting things that will help with the climate change.
Dr. Cho, who do you think is most at risk from the effects of climate change?
I think the people are at most risk are the elderly and the children. They are obviously at an incredible risk. Elderly, because they have a lot of, heart comorbidities or health-related problems as they get older. People who are diabetic and hypertensive, but also children, because they're going to be living longer with sort of exposure to unhealthy climate. But also, it's going to create this incredible disparities between rich countries and poor countries, and even within a rich country, the have and the have-nots. We've seen what disparities in healthcare has done, because of COVID-19, in countries like the US, where you have an incredible income disparity. That's just going to make it worse, because who's most vulnerable to the environmental exposure? People who are poor. And that goes from a micro level, which is a country level between rich people and poor people, but also goes from rich country to poor country. The amount of drought, the amount of, or the decrease in food production in those countries, I mean, it's going to have a devastating effect, not just individually, but as a society and globally. And I think we should really have a moment of pause here about that. And I think that it's important for for everyone to just remember that we don't live in isolation in 2021. We live intimately connected to one another. There is nothing that's happening around the world that's not going to come and affect you.